Welcome back. Hope you're doing well. So today's video, we're going to discuss a little bit about FUE procedures. Very popular all over the internet. Many doctors offering FUE procedures, sometimes only FUEs, no strip procedures or FUT. We offer both, and so I wanted to give you some idea of FUE and what it entails, so that when you get ready to consult with your potential doctor, your potential hair transplant physician, that you know what to ask and you know what could be prevented as far as mistakes. So that's the purpose of the video. We're going to show you some things that can happen when FUEs go wrong and how difficult it is to correct it. Not to scare you, but just to inform you. So again, going to the thing I always say here in this channel over and over again, look carefully who you're going to allow work on your hair, okay? Not everybody does the same work. Look for someone with experience and with training and who knows what they're doing. I have a lot of colleagues and mentors of mine that are doing FUEs exclusively now. Doesn't mean they're bad, but they have no problem telling a patient that they're not a good candidate for an FUE if they think that that's the situation. So not everybody's like that. So be careful and don't let yourself be put in a situation where you have no way to come back. Okay, so I'm going to show you a little bit of a few pictures here and illustrate my points. So I want to show you a little bit what I'm talking about here. Always visual is always best, right? So I have a few pictures that I put together here. This is what we're seeing, unfortunately, much more common than I would love to see. This is a patient, not one of our patients, but had an FUE procedure done, only one procedure, a few months before this picture was done. So as you can see, you can kind of tell, right, where the FUE harvest was done, because obviously there's thinning overall. You know, it's diffuse thinning of the donor area. Every time you take an FUE graft or an FUE follicular unit, that area where the follicular unit used to be is going to be a scar. So when people say, oh, there's no scars, there's always a scar. They may not see it, it may be small, and it should be small, but there's always scars. How do you get to look like this? Well, there's many things. One, size of the punch that's used. There are different diameters of punches for different hair diameters, or different hair calibers, and we need to make sure that we use the correct punch. So that's one factor. Sometimes either doctors with less experience or technicians, or sometimes even the device itself that's been used has limitations on how small the punch can be, and so you end up having bigger incisions and bigger punch diameters, so it creates more scarring. Second factor is how close these incisions are together. When you do FUE procedures, you want to spread them out far apart so you don't have connecting incisions, and that's illustrated here in this picture. So this was done, it's a little bit graphic, I understand, but it's important for you to see it. So you can see here that these are the areas where the FUE grafts were removed from in this patient. If I zoom in even more, I don't know how well the camera can show, but these incisions are really close to each other. So it shouldn't be like that. Also, the punch diameter, the size of that circle, is pretty big compared to the hair diameter of the follicular unit. So if you look closely here, you see that the hair is much smaller than that punch. So a punch of large diameter was used. Too many incisions too close together, and that's going to result in the scarring that you see here. Okay? That's not the same patient, but it's going to give you the same result. So what happens is, at the end of the day, this patient probably couldn't have any more transplants done, certainly not any more FUEs done, because if you take even more hair from here, that's going to look very thin, even worse than it is right now. So you never want to sacrifice the entire donor hair of a patient for one procedure, no matter how much hair they need. Okay, so safety and good sense, common sense is paramount here. This is one of our patients that I saw the other day I did surgery on. And again, is it FUE scarless surgery? It's not, right? So this patient had one FUE prior, somewhere else. And you can see here, if I zoom it in, you see those areas, those bigger gaps, you know, that's scar. So there used to be hair here before, and those hairs were removed with the first FUE procedure. Now, if you look like this, it still looks pretty good. I mean, this is not terrible, it's not bad, but there are certainly some areas that if you look carefully, you could pick out some scars. Not nearly as bad as the other one that we showed. So why are these scars bigger? Now, because again, punch diameter and probably some incisions were done next to each other. So there are adjacent incisions leaves empty spaces. Now, if you look here, these little red dots are the punches that I used when we did our surgery for him. And if you compare, for example, that follicular unit here, this group of hair, to that punch diameter, you see that they match really well. Why? Because when I started the procedure for him, I tried different punch diameters and I picked out the one that's size that fits the size of the follicular unit. I don't need to go any bigger, you know. If I go bigger, the bigger I go, the more scarring it's going to cause. Now I'm going for these bigger hair follicular units. Like for example, this one here is a single hair or double hair actually follicular unit. I don't need a punch that big. I can go for a smaller size. So in the same case, we use different punch sizes depending on the size of the follicular unit, the size of the patient's diameter, hair diameter, and all these factors. Also, you see how far apart they are. They are not connecting to each other. They're not too close together. And that's going to allow those little scars that are going to form. Because I'm not a magician, I'm still going to create scars. But I don't want that kind of scar right here. I want scars that are very, very small, so that when you look at a patient from a distance, you won't be able to see that there was a hair there and there's no longer hair. So that's the principle of the FUE. It should be done correctly, it should be done carefully. If all of it comes together, this patient will be able to harvest a lot more hair in the future because the scalp's going to look good, not a lot of scarring, and he'll have results like this. This is one of our patients a year after an FUE procedure. Now, if I zoom it out really close, you can see that there's some areas, if you know what you're looking for, you can see that there's a little bit of scarring, but that's not the scarring that we saw on the other one for sure. And there's enough hair here for me to go back in because the trauma is very little. So those are the things that are important to see. The problem with FUE is that if you end up with this, there's very little things you can do to correct it, because you're gonna take the hair that you placed there and then replace them here to fix this. The only solution is to go with scalp micropigmentation or tattooing, and we'll talk about that in another video, to then fill in these areas. But you're filling it in with ink, you're not filling it in with the hair, right? As far as transplant capacity, this patient has been tapped out after only one surgery. So again, be careful who you choose, do your homework. A lot of guys out there, a lot of doctors that are very well qualified, very good at what they do, just like me. I mean, have a lot of experience. So choose wisely. You don't have to settle for someone that just does hair because, you know, like as a side of their practice. You should choose someone who does hair as their main procedure. Okay. So as you could see, FUE is not a miracle. It's certainly not scarless surgery. So it can cause some damage in your scalp, and we only have so much donor hair that we have for our whole entire life. So it's very important to use it very carefully. Again, do your homework, look for credentials, go to a few consultations before you decide, and make sure that whoever team you choose to do your surgery has your best interest in mind. Okay? So I hope this was helpful, and I look forward to seeing you in the next video.